So I was thinking, let's talk about glaucoma today because some patients, actually a lot of patients have asked me about glaucoma as well. I'm just going to tell you a little bit about glaucoma and then I can show you the laser surgeries that we do in the clinic for different types of glaucoma. So first of all, glaucoma is a genetic disease and a lot of times it's something that is a silent disease, meaning the patients don't have any symptoms as such, because if you really have end stage glaucoma, some of the symptoms that can appear later on in life are loss in peripheral vision later on in life. And a lot of times the patients come to us just because they are here for a routine eye exam, annual checkup, and we check their pressures. Our technicians, our scribes, they check their pressures and they find out that their intraocular pressure, which means the eye pressure, is elevated. Anything over 20 is usually considered high pressure in the eyes. So then that's um, a little kind of a trigger for us, as in, is it really glaucoma or is it ocular hypertension? Okay, so glaucoma, if it's really glaucoma, it will have some of the signs that we see normally in patients, such as larger optic nerve heads. An optic nerve is the second cranial nerve that comes out of the brain. There are 12 pairs of cranial nerves that come out of the brain, and the second one is known as the optic nerve. So when I check the optic nerve, and if it's more than 5.5 in size, then I definitely consider that to be glaucoma. Then I have to figure out if it is a primary open angle glaucoma versus narrow angle glaucoma versus normal tension glaucoma, or is it ocular hypertension? So just to give you a little bit of a summary of all the different types of glaucoma, if it's primary open angle glaucoma, their pressure is increased in the eye and the cupping is large. The optic nerve head is large. And there's more production of the aqueous fluid in the eye, which is in the anterior chamber of the eye. If it's narrow angle glaucoma, that means that their fluid is being produced, but it's not draining out of the eye because there's a drainage system which involves the trabecular meshwork. And that's the drainage system that causes the fluid to circulate or drain in the eye or from the eye. If it's narrow, that chamber, anterior chamber, if it's narrow, the fluid is going to be kind of like a clogging effect, right? And therefore the pressure is going to be high. And then if it's normal tension glaucoma, their pressures, intraocular pressures may be normal, but their optic nerves may still be large, okay? So the treatment is different for all the different types of glaucoma. The primary open angle glaucoma is usually treated with the help of drops. My first line of treatment is prostaglandins, such as latanoprost or Zalatan. Sometimes I use Rocklatan also, depending on if the patient's IOP is under control or not. The second type of glaucoma, which is narrow angle glaucoma, is also treated with similar drops. And sometimes if the pressure is not decreasing with the help of the drops for narrow angle glaucoma patients, then I have to do a laser surgery, which is known as LPI, laser peripheral iridotomy, sorry. And in that, I make a little hole in the iris part in order to help with the drainage system. And for normal tension glaucoma, I usually monitor them without the help of drops if their pressure is good. But if I see something on the testing which is indicative of progression of their glaucoma, such as OCT is done, this is one test, and then fundus photos are taken. Gonioscopy is done, which is a lens that I put in the eye and check their chambers and see if there is enough pigmentation in the trabecular meshwork. Those are the things that are very detailed and technical, and I will maybe talk about it some other time. But just so you know, if the primary angle glaucoma is not treatable with the help of the drops, then the second line of treatment that I would recommend is laser surgery. For primary open angle glaucoma, the surgery that I do recommend is SLT, selective laser trabeculoplasty. Okay, so that's the one where I go into the eye through my laser machine and I try to target the trabecular meshwork area, okay? And I go maybe one half one time and then the other half the other time. So that's the SLT. The LPI is for narrow angle glaucoma, and for normal tension glaucoma, I already told you what we are doing. Some of the tests that we do recommend for even glaucoma suspects our visual field, which checks the peripheral vision, because the peripheral vision is affected later on in life. We also do the OCT, which checks the nerve fiber layer, which is the covering of the optic nerve head, and fundus photos, and then gonioscopy, like I said, which checks the angles with the help of a lens. For ocular hypertension, their optic nerves may not be large. They may be normal, like less than 0.5 in size, but their pressures could be elevated. And for that, the treatment plan is still the same. I would use a prostaglandin as the first line of treatment, call them back every 6 months, and monitor them. Pressure goes down with the help of the drops, perfect. If not, then I have to add another class of drop. The other classes of drops could be a Combigan, which is brimonidine with timolol, which is a beta blocker, or it could be Cosop, which is a timolol with a dorzolamide, or it could be, like I said, Rocklatan. If pressures are not really going down, we can even recommend an oral pill such as acetazolamide, which is Diamox, and sometimes I have to refer them to Dr. Lahi for a glaucoma invasive surgery. So that was about glaucoma, and then next time what I can do is maybe show you an SLT and LPI procedure that I'm doing in the clinic. Take care, bye.